Hey YouTube, this is City Prepping. I want to start off by apologizing. I haven't really put out many videos in the last few weeks, specifically obviously referring to the coronavirus. I know a lot of people have been asking privately via messages, emails, and asking, what kind of the status, at least from this channel, is on the issue. I'm in the middle of moving. I'm selling my house. I'm buying another one over the next few weeks. We're having to move. So as you can imagine, my life has been in quite a lot of turmoil, but once we settle in, I'll try to continue, producing videos speaking specifically to this issue. On that note, I want to kind of give an update, at least where I stand. I know a lot of people are obviously still very concerned in the emergency preparedness community. Currently, where I put myself is, if you ever look at the military's use of the DEFCON 1 through 5 level, or 5 through 1 rather, I would put myself kind of squarely in the middle of DEFCON 3 in a state of readiness and preparedness. Again, if you follow this channel long enough, we obviously talk about emergency preparedness, preparing for things like this: pandemics, natural events, man-made events. And this one is one of the biggest pandemics, at least at this level. Well, let me back up. It's still being labeled as an epidemic. The World Health Organization has been hesitant to use the term pandemic at this point. I think that's a mistake. I'm sure they're doing it to try to keep people from panicking, obviously. But it's definitely moving in the strong direction of what you would a classical pandemic. It's spreading worldwide. It doesn't seem that it can be contained. There's a lot of unknowns still that exist. And I think probably in the next several weeks, several months, we're going to see it move into the level of pandemic. The only thing I'm optimistic about is that we're going into a warmer season. The summertime's not too far around the corner, so I'm hoping by then that there will be a solution that will either come out, or the warmer conditions will help slow this down dramatically. On that note, there was an article that I was reading recently in the Washington Post. They had a snippet in there that I thought was really interesting. I'll read this and I'll post a link in the description section below if you want to check that out. And it basically says the World Health Organization has not declared the coronavirus COVID-19 a pandemic, and the most devastating effects, including more than 2,200 deaths, are still in China. But the language coming from the organization's Geneva headquarters has turned more ominous in recent days as the challenge of containment grows more daunting. The window of opportunity is still there, but the window of opportunity is narrowing. World Health Organization Director General Tedros, I'm probably mispronouncing his name, said on Friday, "We need to act quickly before it closes completely." So many articles that I read, virologists, a lot of independent reports say the same thing, where the window of opportunity to nip this in the bud, to close it, to contain it, is almost done. And once we hit that point where it's no longer containable or controllable, that's where I would probably say people should really get concerned. What should you do next? I'll post a link to an article I found from a virologist. It's not a peer review article. It's not. This is just one scientist's personal take. He's a virologist, and I thought it was at least, it's interesting how I'm starting to see so many of these individuals that have their take on how you should prepare, and I appreciate some of his points. And again, I'll post a link in the description section below. But some of the things he says is some of the things I say on this channel as well. If you are on medications, do whatever you can to prepare to stock up now. Currently in America, we have a just-in-time delivery system. I'll post a link in the cards above if you want to see a video where I talk about that. And a just-in-time delivery system is a system that is very fragile. It requires everything to be perfect for goods and to move, for example, at your grocery store, for everything to the system to work to make sure the supplies are there. And it also applies to the medical community. What do I mean by this? If you went to the store 30 years ago and you were to open the doors in the back, you would see, shelves stocked with supplies. You don't see that anymore. What they do now is, if you buy an item and you pull it off the shelf and you go to the cashier and pay, a system, the computer will add that information to the system, and the delivery that comes tomorrow will replenish that item. So it's a just-in-time system. Everything is delivered just in time to keep up with supplies. But if there's disruptions or issues like what we're seeing now with a potential pandemic, imagine if people can't show up, if they're sick, the production lines slow down. We're obviously seeing that in China already, and the economic impact that it's causing on the rest of the world. You're going to see that system potentially become more and more disrupted. And I'm saying that because if you are on medicines, anything in particular, I would highly encourage you, if you can, to stock up what you can. The next point, and this is something I've been, we talk about on this channel all the time, stock up on non-perishable foods, or foods that you can keep for a period of time that don't need refrigeration. my only word of advice there is don't buy things that you're not going to eat. If you're not going to eat a bunch of tomato soup or something, don't go buy a bunch of tomato soup. Just try to add a buffer, let's say, of your food supply if you can. Ideally, at a minimum, a month. I know, again, on this channel, I advocate usually 6 months to a year, but for those that are new to emergency preparedness, and I've been getting a lot of subscribers here lately because of this, try to do your best to get at least a month's supply. And I'll post a link in the cards above to a video I did a long time ago that's really popular discussing how to stock up on a 2-week food supply. You can just double that effectively. Think about things that you're not going to be able to get if you can't leave your house. Toilet paper. There's just, imagine if you had to shut the doors of your house today and you can't walk out for a month, what would you need that you would probably run out of? And again, I'm not advocating go blow your credit card up and just buy. I'm just going to be adding a little more to my inventory personally, and I'll talk about that in a second. Other practical considerations. I mean, talk to your boss. See if it gets really bad, can you work from home? If you have children that are in childcare or they get sick, you need to think about a contingency for that scenario. Practical things. Stop touching your face. You saw me a second ago wiping my nose. It's just so hard. I forget the number on the times that we touch our face every hour. It's a pretty high number. But begin to train yourself to stop. Wash your hands thoroughly. That's the biggest thing. Every time you either go somewhere or you touch something, wash your hands with soap, not just sanitizer. Sanitizer is good, but wash with soap and water. Avoid pressing buttons on elevators. Use your knuckles if you can. But think about just whatever your fingers come in contact with, they're eventually going to touch something that you may consume, and it could spread that way. So again, I would encourage you to try to do what you can practically now. I know there was a shortage of N95 masks when this all started. I think some of them are coming back in stock. I personally carry a stock of my own gas masks. These are much higher rated. These are more military grade CBRN. I have talked to the manufacturer, and I've got a hazmat suit, and I'll be adding more of these to my inventory over the next few weeks for myself and family and friends if they need to, for example, come and stay with us if this does escalate. I have talked to the manufacturer, and we're going to try to do a line specifically designed for biological. I'm going to try to get filters rated just for this particular situation. So we're in talks that once I hopefully get that in the next few weeks, I'll start selling those on a website that I'm going to be releasing here shortly. I've had a lot of people ask me where can they get affordable gear, and that's what I've been trying to work with the manufacturer on, because these are rated pretty highly. They're great gear just to have practically, but if you're looking for something a little more affordable, I am working on that right now. So all in all, my word of advice is continue to do what you're doing. Don't live in fear. Just stock up a little and prepare for if this does get out of hand. But the key is this. The key is act now. When you see this, and if it does, God forbid, get out of control in the United States, it'll be too late to prepare then. It will be too late to go to the store rather to get food or get protective gear or basic things that you're going to need, because again, if the just-in-time delivery system goes down, or if there's a run on the stores or panic, you don't want to be behind. Well, you don't want to be with the crowd when that happens. Again, I'm not advocating fear, but just preparedness. So if you have any questions or feedback, post those in the comment section below. If you want to reach out to me privately, you can reach me at cityprepping@gmail.com. I'll do my best to answer as quickly as possible. Again, with the move, I've been slammed, but I'm going to try to continue to help provide support when people have questions, or follow me on Instagram or Facebook, and you can reach out to me privately on those accounts. But again, I'm encouraged where we are today. I feel like where we are at this point in the United States, a lot of friends of mine are physicians and nurses, and I try to talk to them and keep my ear to the ground to understand what's going on, what they're hearing in the community. And so far, they're not at a panic level, but they're definitely at a state of readiness. Again, like myself, what I would consider DEFCON 3. So as always, stay safe out there. If you have any questions, post those below.